Welcome to the Mobile Crisis Timeliness Standards Training, which is a DHCS-funded project led by the Center for Applied Research Solutions, or CARS. And the project is really dedicated to supporting California counties in implementing the Medi-Cal Mobile Crisis Service benefit. So if you're here for a different purpose, we will press ahead and see you another time. But we're focused on the implementation of the Medi-Cal Mobile Crisis Services benefit around the timeliness standards. So as part of the session today, we have to provide this disclaimer that this presentation was prepared by MTAC under a cooperative agreement from DHCS. And while the event is supported by DHCS, the contents are those of the authors and don't necessarily represent the official views of DHCS or the US government. With that, I want to be sure to introduce myself, Nicholas Williams, and Suzanne Rabideau. We are both consultants with Health Management Associates, or HMA, and are helping to support the Center for Applied Research Solutions and the Department of Healthcare Services in the rollout of this new benefit. My background is in policy and planning work for community-based organizations, really with a focus on behavioral health. And Suzanne has worked both at the state level on systems design and as a chief executive officer for a behavioral health provider that specialized in crisis services. And for the better part of the past year, Suzanne and I have been working with counties directly to help support some targeted strategies around mobile crisis response in preparation of this new benefit. So one additional note before we go over the learning objectives and agenda is that neither Suzanne nor myself have any relationship that would constitute a conflict of interest connected to this training. So the learning objectives. As part of today's training, we really have three objectives that we're trying to accomplish. Number one is just making sure that folks understand why timely response is critical for an effective mobile crisis services. Number two, that participants will learn about emerging predictive analytical tools that can help identify the frequency and location of potential crises in the community. And number three, that participants will identify strategies to operationalize and support a timely mobile crisis response, including staffing, scheduling, and dispatch tools. So we'll spend the bulk of our time really on 2 and 3, but as kind of shown in the next slide, our agenda kind of first really goes over an overview of the California Medi-Cal benefit vision. And we're not going to spend too much time here, as many of you are likely familiar with the benefit already, but do want to just kind of do some level setting. Next, we'll review the behavioral health information notices guidance around response times, as well as kind of information related to reporting standards. Third, we'll get into the heart of some of the strategies with a focus first on planning, including the forecasting and scheduling and workforce management concepts, and then about operational strategies, including those technological tools and operational considerations. And then finally, we'll just touch upon some of the monitoring and mobile crisis response times. And as mentioned, kind of at 2 points, we'll have some opportunity to kind of think through some of the workforce management pieces of this, and then also try to have some answers to any questions that you may have as it relates to this work. So a few big picture pieces to make sure everyone here in this training is on the same page about what the vision is for this new Medi-Cal mobile crisis benefit. So the benefit that California is implementing as part of mobile crisis is really just one piece of a new direction that California and other states and communities are taking to make mobile crisis services available and more responsive to community needs. The intent is really based on best practices and research for the response to be a resolution resolution focused, and to provide relief to people in crisis in community, which the evidence suggests really lead to better outcomes. So key to that resolution is focused response to people in crisis, and meeting people where they are in using the least restrictive means necessary to help them. So the kind of principles around this that is really focused on these 6 pieces. So that mobile crisis response services should be person-centered, trauma-informed, equity-driven, brief, with a focus on interventions that seek to de-escalate and resolve crisis, work from a lens of least restrictive interventions, and it should be culturally responsive, linguistically appropriate, and accessible. So while this training on timeliness is not part of the core required trainings identified by DHCS, it was raised in a number of settings as a really important topic by DHCS and counties, both big and small. So what does the BIN say about mobile crisis timeliness? Well, first, the BIN defines mobile crisis services as providing rapid response, individual assessment, and community-based stabilization to Medi-Cal beneficiaries who are experiencing a behavioral health crisis. Mobile crisis services are designed to provide relief to beneficiaries experiencing a behavioral health crisis, including through de-escalation and stabilization techniques, reduce the immediate risk of danger and subsequent harm, and avoid unnecessary emergency department care, psychiatric inpatient hospitalization, and law enforcement involvement. So it really echoes what we've just discussed, with an emphasis on that rapid response around de-escalation and stabilization, reducing danger, and avoiding hospitalization and law enforcement involvement. So with regard specifically to the BIN, specifically to timeliness within the BIN states that mobile crisis teams shall arrive at the community-based locations where a crisis occurs in a timely manner. And then it also specifically mentions that mobile crisis teams shall arrive within 60 minutes of the beneficiary being determined to require mobile crisis services in urban areas, and within 120 minutes of the beneficiary being determined to require mobile crisis services in rural areas. Timeliness standards are not included in the network adequacy requirements or certification. DHC will provide ongoing technical assistance to Medi-Cal behavioral health delivery systems to review response times and adjust the timeliness standards as needed. But it's important to note that response times are required to be reported to DHCS. So with this basic outline of what the BIN says about timeliness, I'm going to transition it over to Suzanne, who I'm sure will have more to add, but we'll really focus on how do we meet these timeliness standards.
Well, good afternoon to all of you. It's good to see so many familiar names on the jigsaw puzzle across the screen here. And I know many of you have been working on this exact topic, and it's good to see other new names. And maybe you've been working on this, but hopefully today we'll give you some tips and tools to help you meet the timeliness standards that DHCS has laid out. The department has not stated exactly what they're going to be doing to monitor performance to these standards. However, they will be monitoring what the county's efforts will be doing. And we do know that their intention is that over time, they're going to enhance the monitoring that they'll be conducting. You all will need to be submitting data that includes your timeliness. So Today, we're going to talk about the strategies that can help you meet those, as Nicholas went over, the 60-minute, within a 60-minute response time or within a 120-minute response time for rural communities. Today, we're going to explore what kind of planning you can do to better meet those standards, and what things you can do on a day-to-day operational way to meet those standards. And we're going to talk a little bit about what you can be doing to do some self-monitoring, and that you can keep correcting and getting better and better at this, because we know that that's quality improvement is always about a continuous quality process. Okay, so we're going to talk about the planning strategies, and then we're going to move into the day-to-day operations. Did want to note, many of you have participated in the activities that the County Behavioral Health Directors Association put together, some webinars and toolkits. Much of the content that we're going to be covering here is covered in the toolkit that was prepared for the County Behavioral Health Directors Association and the tool. And we are going to post with this training on the MTAC website, both these training materials as well as that toolkit and the exact tools. So things that you see today, you will be able to access to do your own planning. And in many cases, I know many of you have been working at this for a while. Okay, so to meet timeliness standards, we're going to talk about workforce management for a bit. And workforce management basically is a term that's been used for many, many decades in other industries, like call center industries, delivery industries. And basically, it's a term that's used to talk about strategies that helps an organization understand what the right workforce is, having the right people at the right time, doing the right activity to meet the expectations. And in this case, we're talking about timeliness expectations. And so going a little further into workforce management definitions, it's activities to help an organization have the right staffing at the right time. And there's activities to do to get you to that, the right staffing at the right place. And that's one is forecasting. What will the demand be for the future? And oftentimes this is done in like call center management. You know, we all have ordered something from Amazon at one point or another, or had an Uber ride or some kind of activity to get us transported somewhere. All of those industries are using forecasting. What will the demand be for the future? What will it be on Sunday? What will it be on Friday? What will it be on Sunday at 2 o'clock versus Friday at 9 o'clock? And we all know in crisis services, demand ebbs and flows based on day of the week and time of day. Another tool that's used in workforce management is scheduling. So you predict what is the demand is going to be, and you take that information and you convert it into schedules that mirror and reflect what the demand will be. And then a final tool for workforce management, and again, these are just the big concepts, right? There's a lot of detail with each one of these, but the last one is monitoring. How did we do against our predicting and our actual scheduling? And are we meeting the time, in this case, the timelines? Are we doing what we need to be doing? And to use workforce tools to adjust in the moment, as well as your overall planning overall. So let's talk about some of the industries, give some examples of the industries that are using these tools. UPS, FedEx, they get things there where they need to be, for the most part, pretty quickly and within the expected time. And generally, if you drop something off at UPS these days, they usually say it's going to be there in a day or 2 days, and we know what it's going to take for it to get there. We pay different amounts for it to get there. Well, they're able to do that because they're using very, very sophisticated workforce management tools. And we can just stop and think about that. Could that be applied to mobile crisis? Transportation vendors such as Uber and Lyft, I mean, they are the ultimate. And we even have the tools not only do they use the tools, but they give the tools to the customers, right? Like you can see when an Uber is coming to get you, or you can see yourself in the vehicle and where you're going and whether they're on track with what they're supposed to be doing, and all other kind of tools baked into that. Customer support centers such as financial services, airlines, healthcare providers, utility companies, they're all using workforce management and have been for a long, long time. Emergency management, ambulance services, and even crisis call centers. And as Nicholas and I and others have met with many of you on different times, we've learned the actual tools you're using, and we're going to demonstrate some of those. We're going to provide some of those examples that counties are actually using workforce management within the crisis environment. So let's just ponder this for a minute, and you can use your chat, or I believe, Andrew, you have allowed people to go off of mute themselves. So if we just think about our own lives, right? Like, how have we come to expect certain industries to respond to us? How do we feel when they do or don't meet our expectations? Have you found yourself annoyed if you're sitting on hold? You know, you want to call your bank for something, or you want to call some financial services or the airlines. And do you find yourself annoyed if the response isn't what you need it to be? So if anybody could put things in chat or unmute yourself, what is your experience? What's your expectations of timeliness, people responding to you? Who hasn't gotten annoyed? I think all of us, right? I don't see anything in chat, but certainly I know myself, you know, even calling for my parents. I'm supporting them with some of their healthcare these days lately. And when I don't get to speak to the person I need to speak to in a timely manner, I find myself annoyed. It's like, why can't they respond in a time frame? And so our world is getting to the point where we expect things to be timely. And then we need to apply that to this industry that we're talking about, right? Crisis, someone's in crisis and they need somebody to respond to them. We need to be able to get there in a timely response. So those 60 minutes and 120 minutes are not unreasonable when we think about someone is in crisis and they need help. And Jeremy, thank you for your response. I definitely find myself annoyed when you have to wait. And if we think about those, most of the times it's just everyday things. We're talking to a banker or things like that. But when somebody's in need of help, being able to have tools to get them to the plate, get to them as quickly as we can. So let's just take a minute, and I just want to walk through some of these other industries that use some of these workforce management tools. So oftentimes, like call centers or delivery operations, say, you know, delivering UPS packages, or Amazon packages, they use data to put into a computer, usually pretty sophisticated computer, but you don't have to use sophisticated computers. And these are the kinds of things that the data that they use to determine how many staff do we need, when do we need to schedule them. So they look to prior volume, you know, how many inbound calls did we have? Sometimes they just look at how many outbound calls did we make and figure all that in to figure out how many staff they need. For deliveries, it's how many deliveries did we make? For the speed of response, they use their average speed of answer. How long did it take to answer the call? For delivery operations, what's your average travel time to get to deliver something? Sounds a little familiar, right? With crisis response. Performance response times. So oftentimes organizations they'll state how fast does something need to happen. Particularly with call centers, they have performance standards. So they have to answer the call in less than maybe say 15 seconds or 30 seconds or whatever the performance may be. For delivery, they may have to get something there within 2 days. And usually we do that for like when we're delivering packages. We want it there in 2 days or ground, whatever the length of time it takes. Activity time. How long then are the call takers on calls, or how long is the average delivery time? Documentation time, average employee off time. So what about that we have to account that we also have to have people that are on holidays or paid off time, or we have to have coverage for people on off time? Average employee downtime, for breaks and lunches, and average other activity downtime. I think you're starting to maybe see some similarities there, right, between these other industries that have been using this for a long time into what we can possibly be thinking about for mobile crisis. So these industries, they take this information and they put it into, usually for these larger firms, they're using some pretty sophisticated software, but this also can be done with spreadsheets, and you'll see that here in a bit. And they take this information and it gives them outputs, like how many call takers are needed. And so we've just used an example here of call centers. We've actually given an example of a free online tool that says, hey, you can, if you're a call center, you can put in this information. It tells you how many call takers you need, how long, that gives you different information, helps you with scheduling. And so you can see that information is put into different tools to determine what your outputs will ultimately be. And here, this slide goes back to the original one we were just talking about, and it adds in the kinds of data that could be used to help predict what you need for staffing for mobile crisis. And so we're just trying to do a comparison. What are other industries using, and how can we apply that particularly to mobile crisis? And so looking at prior mobile dispatch volume, and I know that some of you are just starting to launch mobile, and we're going to talk about, if you're starting from not having any mobile, what you can do to do some predictions. And so we'll address, no matter where you are starting, what the data is that you can use. But our point here is that we just want to say is that it's a similar thing. You can take those concepts and apply it to mobile crisis. Okay, so let's just recap a little bit here, the concepts we've been trying to put forward here as it relates to mobile crisis, using workforce tools, and what a process would be. So you want to be identifying data. You want to calculate what your future demand is going to be in mobile crisis. You want to calculate what your staffing would need to be. And then you take that staffing and you convert it into schedules per where that demand will be. And we're going to go into the specifics. But doing that will lead to the likelihood, will increase your likelihood that you'll meet those response time standards. And the better and better you get at this process, the more and more likely that you can meet those demands. Now, I'm not talking about, you may have staffing issues, is a whole other thing, right? That's a whole other training to recruit, retain. But from a modeling and planning perspective, if you do this over and over again and have better and better data, you will get to a point where you'll get to predict what you need for staffing, where you need the staffing, and hit your response times in a better and better way over time. Okay. I want to emphasize what I said a little bit earlier here, is that each community providing mobile crisis services can use different types of workforce tools. So you've been doing this for a while. Some of you are actually already using some of these workforce tools. All the power to you, keep using those tools. For others, you're going to be starting from scratch, and you may just want to come up with some of your own spreadsheets because of your volume is so small. And so we want to just really make sure that you understand that you can start anywhere. And as your mobile demand may go up over time, you may choose to then switch to using some more sophisticated tools that we're going to demonstrate here. So I just want to point out that there are different tools. There's many tools out there that call centers and the other industries have been using. There's very little out there that's specific to mobile crisis, but you're starting to see some. In fact, California has a tool that I'm going to talk about here in just a minute, and I'm going to demonstrate for you. But there is the crisis resource need calculator. That's on it's a national tool. It's out on the Crisis Now website. And you can look to your own county, input some information, and it will tell you, oh, based on that, we need X number of mobile teams. And we point this particular calculator out because the Department of Healthcare Services, they use that calculator as a starting point to do some estimates of what counties might be seeing in a the mobile encounters. So that's something that you can take a look at in the back. There's a link when you get this training, you can actually click on there and you can get right to that website. But you could go to Crisis Now and go to their crisis calculator and you could see that. We've also, and we're going to go through this today, the County Behavioral Health Directors Association has come up with a toolkit and a tool that it provides some background information on workforce concepts that we just reviewed. It goes into much more detail than we've covered here, so you could take a look at that toolkit. It outlines approaches that you could use specific to mobile crisis, and it also has instructions of walking through a tool that I'm going to demonstrate for you here. So I just want to first emphasize, I'm going to do a demonstration of the tool in just a moment, but I want to let you know that depending on where you are at, you may be a county that you haven't done mobile crisis previously. And so we're going to show you how to move through this tool using just like population data. And you have to use some good estimates and thinking about applying some thought to it. So there's a starting place if you are a county that has not done this before. You may be a county that you've been doing some mobile, but you know you're going to have to be expanding more, and you're not quite sure of ideas of, well, I know we've done it, but I'm not sure with this new benefit what that's going to mean for us for demand, and I don't know what that means from a staffing perspective. This tool that I'm going to demonstrate can help you think about that more. I do encourage all counties to at least look at this tool and get some ideas for themselves about where to start thinking, but then also use any tools you may already be using. And I know that there's counties that are using very specific tools. So in the first scenario I'm going to walk through, it's just going to be about population data. And then there's other counties that have a lot of data. I've been doing mobile for a while, and there's other kinds of data that you could look to help you do some estimates of the future volume. Okay. So, I want to, let me stop sharing my screen for one moment and turn to the tool here. So the tool that I'm going through is a tool of CBHDA. It was provided through a grant from the federal government, from the Center for Medicare and Medicare Services, provided to DHCS and then to Center CBHDA. This was created for counties to predict demand for mobile crisis and also then predict demand for staffing according to the DHCS requirements. I'm going to go through the first 3 tabs here. There's much more on this tool that also helps you do budgeting, but we're not covering that topic today. We are just going to cover the predicting demand and predicting staffing. First, I want to share with you on this tool. The tool there's different colors in the cells throughout here. And the blue signifies that it's data that the county could collect and insert into the tool. The green cells indicate that it's pre-populated with the calculation. And so if something comes up in a green, it means something's been calculated based on assumptions and information that the county has inserted. A gray tells you that has been pre-populated from another tab. And so each of these tabs rolls information to the next tab. And so if you see something in gray, it came from a prior tab. The yellow also indicates that information came from a prior tab. And the orange indicates that there's a little drop down for you to select something. So let's start first with the predicting demand. So we're predicting the demand of mobile crisis. First off, I said that there's orange cells, and here you can pick your county. For the sake of being even, I'm just going to pick the first one that comes up on the list is Alameda County. So the tool, first, it helps you see what your Medi-Cal population is by selecting your county. It pre-populates, remember yellow says pre-populate. You have, it tells you what your Medicaid population is, and then it also indicates to you what your non-Medicaid population is. This tool was intended to help you think about your the Medi-Cal benefit as well as the non-Medi-Cal individuals that you may be serving. The tool is set up in a way that you can select, and a little bit later I'll show you this, but you can select, do you want to be just estimating for your Medicaid mobile, or do you want to be planning for the collective? And we know that many of you are doing both. And so this tool allows you to do that, to do both of those. So if you select Alameda County or the other county, you'll see if I select a different one here, you can see the numbers change. So Alpine is a very small county, very few Medicaid eligibles. Alameda County has 473,000 individuals that are Medi-Cal eligible. Now, I said to you that the blue indicates data that the county needs to insert. And so here you'll need to, based on conversations among your teams, your leaders, the folks that are actually delivering services, whether they're outpatient or inpatient, your emergency rooms, what do you think the possibility is of that population who could be using mobile crisis? Many of you have already been using mobile crisis, and so you may go look to your statistics and say, what have we done in the past? Oh my gosh, it's 0.25%, or it's 0.5% of the total Medi-Cal eligibles that we've done in the past. Or we've never done anything, so we need to take a good just a guesstimate at what this is. But as you do this over and over and over, and you have more data, you'll get more and more precise at what these numbers need to be. You have the opportunity to put in here what's a low estimate, a medium, or a high estimate, so you get some ranges and you can do some modeling. The toolkit also talks about that you need to have some contingencies. What if we use the low estimate, but it's a high, it really was the high that it turns out to be? What are we going to do to quickly adjust? Or what if we decide that we're going to land on using the high estimates? That's what we're going to go with, and it's low. So you have to take some considerations. This tool is not intended to be the number, but to help you narrow down to a better number and better estimate. So in this scenario, for the Medi-Cal numbers, this is saying if we estimate at 0.5%, so it's 0.5% of the Medi-Cal population could use mobile, it's saying that there'd be 2,300 people about using this benefit. And then here, in this particular scenario, it's assumed that for the non-Medi-Cal, maybe it's 1.25% or 1.5% that's using a mobile benefit. Again, based on, you have to use your own data if you have it, or best guesses if you don't have the data. So this here totals up the estimated potential mobile responses for the future. So ranging from 16,000 to 29,000. I'm going to stick, for the purposes of this demonstration, using population data to see how this information now flows over to predicting staffing. So we went through a process to see what is the possible number of mobile responses we'd have to respond to next year, or whatever that the scenario is. Predicting staffing. So in this now going to this next tab. Again, yellow signifies it's something you selected on the prior tab. So this is saying we're still focused on Alameda County. Orange says you have to select a drop down. You can use these estimates using the population data only, or you can use predicting using other factors, and that's further down on that prior tab. There's other things you can do, but I'm not going to go into the detail of that at the moment. So for the purposes of this, I'm going to pick, we're going to use the population data only. So those numbers from here, 16 to 29, carry over to this slide here. Now we're trying to figure out what staffing do we need to adjust, have to meet that level of demand. So this next green, remember green is an automatic calculation. So this calculation is taking the total mobile response and dividing it by 365 days. And it's saying on average in Alameda County, there'd be 64 responses per day to respond to individuals in the community, both the Medi-Cal and the non-Medi-Cal, all the way up to possibly 81 people. So this is per day. Now we're going down to estimated time per each mobile response. So for the 46 responses, the blue, you have to indicate some number for your county. What's your estimated average travel time? Well, we're saying here 1 hour, because indicating that you have to respond to within 1 hour. So the average response time needs to be 1 hour. Also, what's your estimated time for doing a crisis assessment and intervention? In this scenario, it's saying on average, it'd be 1.5 hours to be meeting with the person on average. So this number, again, the greens are pre-calculated. So if you put in here, we think it'll take an hour, this would calculate to, okay, so we got to account for 46 hours in the day to do assessment, or if we estimate it to be 1.5 hours, it would be 69 hours. So we're starting to add up here. We got 46 hours for just arriving at the person or family in need. We got 69 hours we have to account for doing intervention, assessment and intervention. Documentation. Oh, this assumption here says maybe a half hour of documentation. So then it takes this number and calculates the hours that are needed to do documentation. Estimated other time. Maybe there's other activity that you know your mobile teams need to be doing. So maybe there's another hour. This could be 0.5. Okay, we're going to estimate a half hour for each mobile team response. Estimated average follow-up time. Remember, there has to be follow-up. So how much time for that? Estimate an hour for that. So this is starting to add together all the hours that are needed to conduct responses and all the hours that are needed. This is the preliminary total hours needed per day to respond to those 46 mobile responses, 229 hours. This then asks for another, you have to insert here, what is your typical shifts? This is all gonna, something you have to work through. You might choose to use 8 hours. A lot of mobile teams choose to use 10-hour shifts because it allows for overlapping, and it just allows for like 4 10-hour days and 3 days off, all kinds of scenarios. In this case, we said there's 10-hour shifts. So this says, how many teams do you need per day to respond? This says it needs 23 teams up to 41 teams per day to respond to those 46 people or individuals and families. There's other factors that need to be accounted for. There's mealtime, break time, there's supervision time, training time. So there's other things that you can add into your calculation of people's time, right? And so in this particular scenario, it showed up that, so the number, when it adds all up, there's the total of 300 hours a day that are needed. And if you have 10-hour shifts, this is saying you need 30 teams working throughout the day to meet those 46 people. And then this is the number of staff you would needed per day to be on teams. Remember, it's a 2-person mobile team. So you would need 60 people in this scenario per day. Total mobile team hours needed to work per week, and then total hours needed weekly for all staff. And then this calculates into then how many FTEs do you need overall to get you through the week to meet 46 people in the community per day. So this is your number of FTEs that you need. We also have here, remember the orange tells you that you need, you can pick something. Sometimes the numbers are so low, like remember we picked Alpine for just a moment and it showed a very low number. Well, these numbers would come up and it says you need 2 FTEs. Well, 2 FTEs are never going to get you around the clock. And so in those scenarios, when the numbers are very low, you also can say there's a minimum factor and you say that you need 10 to get you around the clock. And so you can pick, am I going to use the predicted? Certainly in this hypothetical situation for Alameda, they're going to definitely want to pick what was predicted. They're going to need 105 staff. So now this tells you the number of staff overall. The next section here helps you think through the types of staff. In the behavioral health information notice, it says the types of staff that you can have on the mobile teams. And so you could allocate some and say, okay, we think we're going to need to recruit so many of these different types of staff. The behavioral health information notice says at least one person on the team needs to have gone through the training for the crisis assessment. And so you need to have at least half. We suggest you at least say 60% of your people are able to do an assessment. You maybe want that higher as time goes on, but at least 60% of your people need to be able to do an assessment. So of these folks, so if you need 63 people, you'll need 63 people of the 105 that can need to do assessments. And so what you want to do is say, okay, how many, again, blue counties insert information. How many people do we need to get to the 63? In this scenario here, all of this adds up to a calculation. This is saying you actually have more than you needed. So you need to just maybe put like 20, 20, 20, and let's say, if you have 15 of certified peers, you'll get to your 63. So this number needs to equal this number. And then how many more people do you need to be sure that you have the 2-person mobile team? So in this case, if you said 60% you need 63, it calculates for you. And this also automatically pushes, then okay, then 40% of the people they don't have the qualifications to do assessment. We need 42 of those people, and then allocate across where you think you'll be recruiting those people. So this tells you what's the volume, and therefore what number of people do we need to have. I want to go back to this other tab for one moment here, because what we used here was just the top portion of this and use strictly population data. You also could insert other data that you have for your county. Remember, blue is what you insert. So you may have information, how many prior mobile responses have we known we've already had? So you could insert a number and then using the high, low, high, medium, low, medium, high, how many do we anticipate of that number would continue to need mobile for the future? And it gives you all kinds of scenarios. How many people are receiving behavioral health services for the county? Okay, of those folks, how many people do we think could use a mobile response in the future? Individuals who receive substance abuse services. How about the 988 call volume, reaching out to the 988 center in your community and asking them what their call volume is, and then saying, okay, of that, how many might they then be referring to us for a mobile? You may not have that relationship yet, and so maybe there's not a number in there and you're going to add that for your future predictions. What about maybe you run your own crisis lines and you have the number of how many calls came in last year? And of that, maybe you have data that says what was the mobile response. Maybe working with your law enforcement partners, maybe how many, the 911 and law enforcement, how many calls came in there that were behavioral health that you think could be converted to a mobile response, responding to them as opposed to law enforcement. So you could be working with your partners to come up with a number here, an estimate. Emergency department. How many people went to emergency departments? Is it possible that we could convert them to that we could go before they ended up in an emergency room? How about individuals in emergency department that are on civil commitment holds? Prior 5150s, prior year 5150s, inpatient. And so there's all kinds of data that you could pull from to use to make estimates. And then there's other considerations identified. Maybe there's not something on this tool that you say, you know, here's a good data point that we want to use to include into our estimates. So once this comes to the end here, this gives the estimate of how many mobile responses. And then when you get to the predicting, moving to the next tab here, you could decide, okay, instead of using just the overall population data, I'm going to use the other factors, and that's the number we want to use. So this gives you the staffing that you need. So I'm going to stop sharing and go back to the presentation. So I just went through the tool that showed you how to predict demand and then how to predict staffing levels per the Behavioral Health Information Notice staffing requirements. So that was predicting. Now we want to shift the conversation to talking about scheduling. Just to bring this back again, right? We're talking about how do you have timely response? So you have this information that says, here's what we predict the demand will be. Now we need to start thinking about things like, we have the staff, we've said we need 14 people or 15 or 25 or whatever the number is per your county. Where do they need to be scheduled? For those counties that actually have some historical data, you may go back to the extent that you have this data. It's like, when was the mobile team, when did they go to the community? And this heat map here shows you that later in the week and later in the day is when the most requests and responses from mobile crisis occurred. And so here you see the bluer, deeper blue, and that says, wow, there's more demand there. And so you want to see about how do you get your staff to mirror when this demand is. If the next slide here shows how to take that information and then mirror it to what the need is. So this slide, the yellow, shows the demand. So on this particular example, just an example, early in the morning, there was one mobile team that was needed per these different incremental hours. One, the yellow line is the demand. As the morning came about, it went up to, there was 2 mobile responses that were needed at any one time. So here the yellow line starts to show there was 2 teams needed. Then as the afternoon approached, it was more like 3 mobile teams at one time was needed to respond to individuals. And as time went on further into the night, there was 5 requests or 5, there was 5 people that needed mobile. The red line here shows a scenario where there's just 2 teams scheduled all the time. And if you had just 2 teams scheduled all the time, in the early morning, you're going to be way overstaffed. During the day, you're going to probably be right on point. But in the evening, you're going to be way understaffed of where the demand is. This next slide shows how teams could be scheduled to meet demand. So we give a scenario, the top piece here is on a Sunday. This was the predicted demand using some of those prediction tools, that we know that this is about the number of times people needed mobile teams on a Sunday by time of day. So in this scenario, you could put a spreadsheet together and say we basically need about 2 teams. So we're going to schedule a team here and here. They may have started earlier on the prior day, but they're scheduled here starting at 1 a.m. You've got 2 teams on. And then even through the morning hours, you have 2 teams on, but that as demand picks up, you add 1 more team in the late afternoon. So starting here, you have 3 teams scheduled at one time. And well, these people have been on for a while, so they need to go home. And so you need another team. And so you could use spreadsheets to start filling in where's the demand and how am I'm going to have a scheduled team during those times. We know historically Fridays and Friday evenings are busier days than Sundays. And well, Sundays during the day could be a busier day, but we do know that particularly Friday evenings has a higher demand. And in this scenario, you can see these numbers that came from that heat map. These numbers are much higher here. And so we need more teams. In this scenario, there's 5 teams that are scheduled. Earlier in the day, there's just 2. As the day goes on, there's now 3. As the day goes on, there's 5 here. You got a team going home, so you bring in some other teams in the early evening that likely go through to the next day. So you can see you're scheduling to the demand. So we've just walked through predicting the demand, predicting how much staffing you would need, and then creating schedules that mirror to that predicted time of day that a mobile team may be needed. I want to assure you that those of you who have this data, you could just use spreadsheets to do this, but there could be tools, and we're going to talk about that in a minute. But those of you who have not started this, you're going to take those numbers and you're going to have to do some best guesses to get going. We know that the evening hours are generally higher from other communities. We know that emphatically. And so you might want to have overnight, if it's a very small community, you just have 1 team available. And as the day goes on, you might have 2 teams available. And as you collect more and more data, you will know these numbers, and you can then keep moving shifts over time. Okay, now I'm going to move to a couple of what we just talked about was planning. Now we're going to talk about what things that you could do day to day within the operations of the mobile teams going out to meet timeliness standards. So first off, there's technology tools. I don't know why this, okay, let me just get this all up here. Well, that's interesting. Okay, so first off, low tech, just starting this, you might use low tech, but as time goes on, you might want to consider using some more tools. So the electronic dispatch tools. And I'm going to use something that's happened in California in the county of, oh, actually, that's not the slide here. Some communities within California and across the nation are using electronic dispatch tools. So they use that GPS technology to know where teams are. So they can select, they can say we have a call on the north part of town, we've got a team on the north part of town, we're going to assign that team to go because we can see on this software the closest team. The tools also expedite sharing information. So you could have tools, there's an electronic tool at a dispatch, and there's a phone in the community with the team. They quickly get the information, and you're not sharing as much information by phone. Oftentimes, there still is a regular phone call that occurs to get clarification on things or more information that's needed. It also increases the accuracy of information that's being exchanged, and it timestamps things for you. So it automatically collects data. So all of those things that I just showed you about predicting demand, creating schedules, timestamps are within that software. So it's automatically collecting that information, and then you're using it to come up with then you're using maybe another software, scheduling software, that's used to schedule according to where the demand is. And finally, there's also some tools like a geolocation analysis tools. The GPS analysis tools will put things on a heat map. So the far right corner there is an example of a heat map of, so say the red may signify where there's some intensity of where we've had mobile responses over, say, the course of a year. That signifies the most intensity of where mobile responses have been. Or the black may indicate the next level of intensity. And then you can use that to help mobile teams know things like, do not hover on in this particular example, do not hover on the west part of town, because we know the chances are you'll get a call on the east part of town. So hover back. So this can help you understand on a day-to-day basis where to place mobile teams. And for your overall planning, you may say, you know what, those we have 3 teams all the time. 2 of the teams are going to be centered in the concentrated area, and that one other mobile team is going to maybe do more hovering on the outside to get to the further distance if they're not already on a call. So you could be using some of those tools to help you do some future planning and real-time planning. Okay, so now I'm going to share with you how San Diego County has used some of these tools. And I know that many of you may have been on the office hours last Thursday, and they shared some of these tools specifically. So San Diego County utilizes a tool called Beacon Dispatch. It's from a company called Medtrix, and there's a link that you can get to this. But it helps them support efficiencies in communication with mobile teams. It tracks in real time the status of a mobile team dispatch. Are they available? Are they on a call? Are they doing after call paperwork? It tracks the status in real time, what the mobile team is doing. They also use some software called Humanity Online Employee Software. It's just one software. You could go online and find many, and I'm sure many of you are using your own. They take information from that dispatch tool and insert it into the scheduling software, and it helps them come up with the schedules that mirrors the time of day, the days and the time of day when mobile teams are needed. It also allows them to use self-service tools with their mobile teams. So mobile teams can go in, they know their schedules, they can request time off, they can see we have a shift that's empty, I need it filled, I'm willing to take that because I'm not scheduled. So it not only allows them to do the precise scheduling to meet where the demand is, which ultimately gets you to your performance standards, your response performance standards. It also has some other really nice features that staff really like. Keep in mind, communities with less mobile volume could easily use a spreadsheet for some of these things. So we're not advocating that you have to go out and get these. It's just that if your volume is higher, you're likely going to want to use this. And we do know that some smaller communities have used these types of tools because it just provides them efficiencies. Okay, I talked about, here's another in the moment strategy. I talked about having some GPS capabilities and identifying where in a community the mobile responses generally go to more than other areas. And so you could use what's called a hovering strategy and inform mobile teams. We want you to stay central to a particular city. Don't spend your time in outlying areas unless you're asked to go there, because they can reduce the travel time it takes them to get where they're going by using these hovering strategies. Okay, call outs. Your schedules need to also include for the scenario of individuals calling out, right? So you may have on those schedules who someone needs to take one on-call shift. You don't have to come in unless there's been a call out from someone else. And it's really important that I don't know why this is going backwards, but call outs not only impact your response times, but it impacts the other staff, right? If I was only going to be going to 4 mobile responses on my 10-hour shift, and now I'm having to do more, and it's backed up, it just creates more stress. So we're not only having a call out backup plan is critical, not just for meeting your timeliness standards, but it's also effective for avoiding staff burnout. And we know that with all of the workforce shortages, the last thing we need is for people to be burnt out. And now you're back into having to rehire. Okay. Don't know why this is doing this again. Here we go. Okay. A few words about monitoring the mobile crisis response times. Now, you're going to want to be doing this for your own information, right? To stay on top of how well are we doing and what do we need to do to keep getting more precise and better at this. Just using these tools will help that your response times get better. So the BIN requires that mobile crisis teams shall arrive at the community-based location where a crisis occurs in a timely manner. And we've reviewed this before, that within 60 minutes of the beneficiary being determined to require the mobile response, or within 120 minutes of the beneficiary being determined to require a mobile response. So for monitoring purposes, data points to collect must include at least the following: the time that a decision is made to the person needs a mobile team. So there needs to be a decision time mark. There also needs to be a time mark of when the mobile team arrived. That would be the time from decision to time of arrival equals the response time. So this was at 12:10. They arrived at 12:30. The response time is 20 minutes. You may also consider collecting other data points to help you with your efficiencies, but for reporting purposes and monitoring your response times according to the BIN, you need at least these 2 data points, but you may have other data points that you want to collect to support your efficiencies. So when was the decision made? When was the mobile team notified? And when did they arrive? There might be another data point there because maybe it's taken 20 minutes to get the information to the mobile team, and it's taken them, let's say, 50 minutes to travel. Well, now they're saying, well, it only took 50 minutes. We're in our hour. Well, it took from the point of decision another 20 minutes. So now you're over the time. So if you collect additional data points starting from scratch, you'll be able to do an assessment of why are we not meeting our time periods? Well, it's that communication time period. Okay, what do we need to do to reduce that communication time period? Some of it might be using a dispatch tool because they know right away, and then they might also have a button they push to say, received the information. So now you know you have other data points. So consider other data points, specifically if you have some dispatch tools. So to summarize all that we just talked about, over the past decade, workforce management has become a commonplace term in many, many industries. And those workforce management tools do many things, but it also helps an organization meet their performance metrics. And in this case, response times. Predicting mobile crisis demand and staffing needs is critical to ensuring that you have the right level of staffing that you need to meet the beneficiaries in a timely manner. And developing schedules that mirror when a mobile team is needed by day and by time of day will help you get to meet those response times. And collecting and analyzing data is critical to monitoring these response times. So we're going to stop here and answer questions that you may have. So you can either put questions you have in the Q&A or in chat. And I see there's been quite a few chats going on since I've been talking. Nicholas, do you have?
Yeah, I'll just pull a couple of them. Myself and Danielle tried to address. But the first question was just, are there any specifics on what information DHCS will want reported on when submitting response time data? And I think you covered some of that now, but just any additional specifics around that.
So DHCS is going to be coming out with information on all of the reporting requirements. This was one of the items. And in our conversations with them, they indicated to be able to make sure that counties are able to collect at least those 2 data points so that you then can report response times. The detail of how that will be submitted, what will be submitted is still yet to be determined, but you need to have at least those 2 data points to be able to do that reporting.
And another question that came up in the context of when you were going through the Excel tool was just a question of, couldn't some of the guesswork be taken out by Medi-Cal, looking at past years for what percentage of folks access some sort of crisis services?
Yes, that's kind of built into that tool, but the tool was created for the county or in collaboration with a subcontractor, if the county chooses to do that, to when it says what other kind of data do you have, you could take what kinds of services have we submitted and put that into that tool to help you come up with estimated mobile response. And so this is a tool for you to be predicting what you need and then predicting the staffing that you'd be needing. And that's one of the best data points you could look at, is what crisis services have been provided in the past. You also have to be cautionary that now that this new benefit is available for this mobile, the demand will be going up as more people become aware of this. So the toolkit actually talks to this too, is coming up with your estimates of out the gate, and then what is the ramp up time? So what you get out the gate, and then you have also some marketing that you plan to be doing over time. Well, how is that going to start impacting people being aware and then asking for that kind of help? Or if you're working with law enforcement or schools and they start to learn about this benefit, that will increase those numbers from past utilization. But great question, past crisis services, yes. Okay. The other thing too is when you go to like the office hours, that would be a good point. If once you start using that tool, if you haven't already and you have more questions, you could let the MTAC team know that you'd like to ask some questions about the use of that tool in those office hours. So this isn't a one and done training. It's you got to go use these, but you have other opportunities to continue to ask questions. We have one question for you in chat, or by taking yourself off mute. What's one thing you've learned today, or how has your mind been stimulated in thinking about the next question? What's some things that you think that you need to be doing next based on the materials that you've heard today? So either in chat or taking yourself off mute. Yeah, good, Tracy. A predictor. And then that rolling into, okay, if we predict that many, what kind of staffing do I need by the different allowable mobile team members? Yeah, there are tools that can help determine staffing. Yes. And I want to emphasize again that the tool wasn't intended to be used of one time. The tool is intended to be used to get you going, if you haven't already been going, or to help create some logic and thoughtfulness about how you might predict for the future. But then as you get more and more data, you go back and you keep refining, and you get better and better at knowing what is the staffing levels, and then where and when do we schedule them? Because that alone can make a difference in meeting that timeliness, right? Because that's what we're talking about here. How do you get to people in a timely manner? Predicting staffing and scheduling, data points, yes. Okay, I'm going to turn it back to Nicholas to do some wrap up for us. And I'm, let's see here.
Yeah, just a kind of quick call out, and I think we started to address some of this in the context of the chat, but is kind of standard practice at the end of these trainings to provide some resources, things that were cited on one slide at the end of the slide deck, so that you kind of have that at the ready. And I'll just add or verbalize kind of what I put in the chat with respect to the mobile crisis workforce and budgeting toolkit. So there's a PDF toolkit, and then there's the Excel spreadsheet, and the toolkit is intended to be kind of used as a companion to the Excel document that Suzanne went over, and that right now is housed on the CBHDA member website. But the plan is to share that out as a resource as part of this training, and so it will eventually end up on the MTAC website just as soon as we kind of get the appropriate approvals from DHCS. So we will be sure to kind of share and make sure that's available to anybody who can't get it through the CBHDA member website. Let's see, and then just one last kind of page here is around the contact us. So this is all the members of the CARS team that are really heading this initiative. Project Director Miranda Marsh, the Field Director Danielle, and others as part of this team who are really kind of participating in all of the trainings and steering the ship. So thank you all so much.